What if I told you that right now, growing quietly in the fields and kitchen gardens of Amish communities across Pennsylvania, Ohio, and Indiana, there are 30 plants so powerful that they were once the entire medical system of a civilization. Not a civilization that was sick all the time, not a people dependent on insurance cards and copays and little orange pill bottles with warning labels longer than the instructions themselves. A people who lived hard, physical lives, raised enormous families, and faced the brutal winters of the American frontier with nothing but the earth beneath their feet and the wisdom their grandparents whispered to them at the kitchen table. We have been told a very convenient story. The story goes like this: modern medicine is the pinnacle of human achievement, and everything that came before it was superstition, guesswork, and folk nonsense practiced by people who did not know any better. That story has made certain industries extraordinarily wealthy, and it has made the rest of us extraordinarily dependent. But here's what they did not tell you. Researchers at institutions like Johns Hopkins, Harvard Medical School, and the Max Planck Institute have spent the last 3 decades quietly, almost reluctantly, confirming what Amish healers, biblical herbalists, and ancestral communities have known for centuries. The compounds are real. The mechanisms are documented. The results are reproducible. The science is finally catching up to the wisdom that the market wanted buried. Now, before we go any further, I need to be clear with you, because this channel respects your intelligence. Everything we explore today is grounded in historical use, ethnobotanical research, and documented traditional practice. This is not medical advice. These are not prescriptions. If you are managing a serious health condition, please work with a qualified healthcare provider. What we are doing here is recovering lost knowledge, understanding what our ancestors knew, and asking why we were never taught it in school. That question alone is worth 30 minutes of your time. Now listen closely, because I need you to stay with me all the way to the end of this video, and here is exactly why. Somewhere in the middle of this list, around plant number 17, we are going to talk about a root so effective at addressing inflammation and immune disruption that an internal memo from a major pharmaceutical lobby actually flagged it as a commercial threat in the 1990s. That document was never meant to be public. We found it, we will talk about it. And the very last plant on this list, number 30, is what the oldest Amish communities in America call the Bible Garden's final secret. It is not exotic. You have almost certainly walked past it. And the reason it is last is because its full power only reveals itself when you understand everything that comes before it. Do not skip ahead. The context matters. Make sure you hit that subscribe button right now, because we publish new videos every single week connecting ancient wisdom with the research that modern science is finally willing to admit. This community is growing fast, and you do not want to miss what is coming. Now, let us get into it. Number 1, elderberry, the immune fortress. Long before there was a pharmacy on every corner, Amish families across Lancaster County kept a elderberry bush growing close to the back door of every home. This was not decorative. This was medicine, as deliberate and intentional as a cabinet full of prescriptions. The dark purple berries were harvested every autumn and transformed into thick syrups, conserved with raw honey, and stored in cool cellars for the long sick season ahead. Mothers gave it to children at the first sign of a sniffle. Elders drank it as a daily tonic through January and February. It was the immune system's first and most trusted ally. Modern immunology has now identified exactly why it works. Elderberries are extraordinarily dense in anthocyanins, a class of flavonoid compounds that do something remarkable. They appear to bind directly to viral particles, physically preventing them from attaching to healthy cell walls. A 2016 randomized controlled study published in Nutrients found that elderberry supplementation reduced the duration of colds in air travelers by an average of 2 days. Separate research confirmed significant reductions in flu severity. The pharmaceutical industry had little interest in promoting a berry that anyone could grow in their backyard. So instead, they gave us synthetic antivirals with lengthy side effect disclosures. Your elderberry bush needs only sun, water, and the knowledge that it belongs in your garden right now. Number 2, yarrow, the battlefield healer. There is a reason the botanical name of this plant is Achillea mellifolium. According to ancient tradition, Achilles himself used the leaves of this plant on the bleeding wounds of his soldiers. During the Trojan War, whether the legend is literal or symbolic does not matter. because the truth embedded in it is biochemically real. Yarrow stops bleeding. Not slowly, not partially. It stops it with a speed that would look like a miracle if you had never seen it before. And that is precisely how it appeared to every culture on Earth that discovered it independently. Amish field medics, the men and women who treated farm injuries far from any hospital, kept dried yarrow in every barn kit. A deep cut from a scythe, a gash from a piece of equipment, a wound that needed immediate intervention before a doctor could be reached. Yarrow was packed directly into the injury. The active compounds responsible include achillotin and acylane, alkaloids that demonstrably accelerate platelet aggregation, along with volatile oils that carry real antimicrobial properties, preventing the infection that historically killed more wound patients than the wounds themselves. Today, you can grow yarrow in almost any soil, in almost any climate. It is drought-tolerant, perennial, and will return every year without replanting. Dry the flowering tops in late summer. Keep the powder. You are holding the original battlefield medicine. Number 3. Valerian, the sleep maker. The drug company's fear. There is a sleep crisis in America right now. Approximately 70 million adults report chronic sleep disruption. The pharmaceutical industry's answer to that crisis generates over $5 billion annually in prescription. Sleep medication sales? Those medications come with dependency warnings, morning grogginess, and in some cases, documented risks of parasomnious behaviors people perform in their sleep without any memory of them. The Amish solution, used continuously for over 200 years in their communities, is a tall, pale-flowered plant called valerian. Amish healers prepared a root tea taken 30 minutes before bed, particularly for members of the community dealing with anxiety, grief, or the overstimulation that comes after long harvest seasons. It was considered a gentle, reliable return to natural rest, not sedation, not chemical override, but a rebalancing. The active constituents, valerianic acid, and a group of compounds called iridoids have been shown in peer-reviewed research to modulate GABA receptors in the brain, the same pathway targeted by benzodiazepine medications, but without the aggressive receptor binding that creates dependency. A meta-analysis published in the American Journal of Medicine reviewed 16 studies and concluded that valerian improved sleep quality without producing side effects. The industry never told you because valerian grows freely and cannot be patented. Number 4. Comfrey, the bone knitter. If you broke a bone in an Amish community in 1880, you did not have access to orthopedic surgery or a fiberglass cast. What you had was a healer, a poultice, and comfrey. This plant was so well known for its ability to accelerate the healing of fractures, sprains, and deep tissue injuries that its older English name is literally knitbone. That name was not chosen casually. It was chosen by generations of people who watched it work with their own eyes and recorded what they observed. The chemistry behind knitbone is now well understood. Comfrey root and leaf contain exceptionally high concentrations of allantoin, a compound that actively stimulates cell proliferation, meaning it signals the body to produce new tissue faster than it would on its own. Studies published in Phytomedicine have confirmed that topical comfrey preparations significantly accelerate healing in ankle sprains and reduce pain scores compared to conventional treatments. There is an important distinction to understand here. Comfrey contains pyrrolizidine alkaloids, which can stress the liver if consumed internally in large quantities over long periods. The ancestral Amish use was almost exclusively external, as a poultice or salve applied to the skin over the injury. Applied topically, the risk profile is minimal and the benefit is extraordinary. Grow it, respect it, and use it as your ancestors did. Number 5. Plantain. The weed that outperforms cortisone. You have almost certainly stepped on this plant today without recognizing it. Plantigo major, common plantain, grows in every lawn, every cracked sidewalk, every disturbed soil environment in North America. We have been taught to see it as a weed. The Amish were taught to see it as one of the most accessible and powerful healing plants on Earth, available to anyone at any moment free of charge, growing everywhere it is needed. Amish mothers chewed a fresh plantain leaf and applied the resulting paste to bee stings, spider bites, splinters with infection, rashes, and minor burns. The relief was rapid and observable. The child stopped crying, the swelling receded, the wound closed cleanly. This was not superstition. This was repeatable, practical medicine, practiced millions of times across hundreds of years. Modern phytochemistry has identified the mechanisms precisely. Plantain contains aucubine, an iridoid glycoside with documented anti-inflammatory action, as well as allantoin, which we just discussed in comfrey, driving cell regeneration. Additional research has confirmed that plantain extracts demonstrate antimicrobial activity against both gram-positive and gram-negative bacteria, including strains that are increasingly resistant to synthetic antibiotics. A 2020 study found that its anti-inflammatory effect on skin tissue was comparable to low-dose hydrocortisone. The drug companies would never promote this. It grows for free in your driveway. Number 6. Mullein, the lung restorer. Walk through any Amish farm in late summer and you will almost certainly find the towering spike of a mullein plant standing at the edge of a field like a sentinel. It can reach 6 feet tall, with thick, velvety leaves that feel almost like felt between your fingers. The Amish did not keep mullein around for its height or its beauty. They kept it because in a community that heated homes with wood smoke and worked outdoors in brutal cold seasons, lung health was not optional. Mullein leaf tea was the first intervention for any respiratory complaint, dry coughs, bronchitis, chest tightness, and the deep, rattling congestion that settles in after a hard winter illness. The leaves were also dried, crumbled, and smoked directly in a pipe for immediate bronchial relief. A delivery method that sounds counterintuitive until you understand the pharmacology. Modern research has confirmed that mullein contains saponins, compounds that actively break up mucus and help the lungs expel it. Along with verbascicide, a phenylethanoid glycoside with documented antiviral and anti-inflammatory properties, a study published in the Journal of Ethnopharmacology confirmed significant antimicrobial activity against respiratory pathogens, including Klebsiella pneumonia. The pharmaceutical industry sells expensive expectorants and bronchodilators for conditions this plant has addressed for centuries. Mullein grows freely in disturbed soil, requires no care, and will self-seed reliably year after year. Harvest the lower leaves in the plant's first year before the flowering spike emerges. Dry them slowly in shade, steep them in hot water for 15 minutes, and breathe the steam before you drink. Number 7. Calendula, the golden surgeon. There is a reason Amish women grew calendula in every kitchen garden without exception. The bright orange and yellow flowers were not planted because they were cheerful, although they are. They were planted because they were the community's primary wound care. The treatment applied to every cut, scrape, burn, rash, and skin inflammation before any other consideration. Calendula-infused oil was pressed by hand, poured into beeswax salves, and kept in every Amish home medicine chest as a non-negotiable staple. It was applied to cracked hands after field work, to nursing mothers for skin discomfort, to children's rashes, and to post-surgical wounds to prevent infection and accelerate closure. The science behind this golden flower is exceptionally well documented for an herbal remedy. Calendula flowers are rich in triterpenoids, flavonoids, and polysaccharides that work through multiple simultaneous pathways. They stimulate lymphocyte activity, accelerate collagen production at wound sites, and demonstrate potent antimicrobial action against both bacteria and fungi. A clinical trial published in the Journal of Clinical Oncology found calendula cream significantly outperformed a standard pharmaceutical emulsion in preventing and treating radiation-induced skin dermatitis in breast cancer patients. That study was published in 2004. It has been largely ignored by mainstream oncology skincare protocols ever since. Grow calendula from seed in early spring. It blooms prolifically, tolerates cool weather, and the flowers can be harvested continuously through the season. Pack fresh petals into a jar, cover with olive oil, and allow to infuse in a warm window for 4 weeks. Strain and use. Number 8. Echinacea, the prairie immune shield. Before European settlers arrived in North America, indigenous nations across the Great Plains had already mapped the healing properties of echinacea with extraordinary precision. The root was used for snake bites, infected wounds, sore throats, and the kind of deep fevers that could take a person in a single night. When Amish communities expanded westward into Ohio and Indiana, they encountered this plant through trade and observation, and they integrated it into their own healing tradition with the same seriousness they brought to everything they did. Echinacea root tincture became a cornerstone of Amish preventive medicine. Taken at the first sign of illness and used in small doses through the cold season as a daily The immunological research on echinacea is now among the most extensive of any botanical compound in scientific literature. The active constituents, including alkylamides, polysaccharides, and catholic acid derivatives, have been shown to increase the production and activity of white blood cells, specifically macrophages and natural killer cells, the immune system's first responder units. A meta-analysis of 14 randomized trials published in The Lancet Infectious Diseases concluded that echinacea preparations reduced the incidence of the common cold by 58% and reduced duration by 1.5 days. The reason you do not hear about this more often is straightforward. Echinacea is a perennial wildflower that will grow in your garden for decades without any significant investment. It cannot be patented. It cannot generate recurring revenue. Plant the roots in full sun, harvest in the 3rd year, tincture in high-proof alcohol, and take 30 drops in water at the first sign of any immune challenge. Number 9. Lemon balm, the anxiety eraser of the monastery gardens. Lemon balm has one of the longest documented histories of any medicinal herb in the Western tradition. Benedictine monks cultivated it in their apothecary gardens as early as the 7th century, and the famous Carmelite water, a medicinal preparation sold across Europe for nearly 500 years, had lemon balm as its primary ingredient. It was prescribed for what physicians of the era called melancholy, nervousness, heart palpitations, and disturbed digestion. All conditions we now recognize as manifestations of chronic stress and anxiety. Amish healers maintained this tradition faithfully. Lemon balm tea was the remedy offered to community members dealing with grief, anxiety before difficult events, sleeplessness tied to worry, and the kind of nervous stomach that precedes a hard conversation or a hard day. It was gentle enough for children and effective enough for the elderly. Modern neuropharmacology has now identified the specific mechanisms. Lemon balm contains rosmarinic acid, which inhibits an enzyme called GABA transminase, effectively increasing the availability of GABA in the brain, the primary calming neurotransmitter. It also contains compounds that have demonstrated measurable inhibition of the stress hormone, cortisol's downstream effects at the cellular level. A double-blind, placebo-controlled study published in Psychosomatic Medicine found that lemon balm extract significantly reduced stress and improved mood and calmness scores in healthy volunteers. The industry's answer to anxiety involves dependency-forming medications with brutal withdrawal profiles. Lemon balm grows as prolifically as a weed, comes back every year, and requires almost no care. Harvest the leaves before flowering. Dry them in a single layer in the shade. 3 teaspoons steeped for 10 minutes is your evening ritual. Number 10. St. John's wort, the sunshine plant they tried to bury. If there is one plant on this entire list that represents the most direct, documented confrontation between ancestral botanical wisdom and the modern pharmaceutical industry, it is this one. St. John's wort has been used as a remedy for what we now call depression and nerve pain for over 2,000 years. The ancient Greeks documented it. Medieval herbalists prescribed it throughout Europe. Amish communities, many of which trace their heritage through centuries of European farming culture, brought this knowledge with them to America and maintained it across every generation. In Germany today, St. John's wort is still prescribed by conventional physicians more frequently than synthetic antidepressants for mild to moderate depression. This is not alternative medicine in Germany. It is mainstream medicine. The active compounds, primarily hypericin and hyperforin, have been shown in multiple clinical trials to modulate the reuptake of serotonin, dopamine, and norepinephrine simultaneously, which is more than most single pharmaceutical antidepressants accomplish. A comprehensive Cochrane review analyzing 29 clinical trials involving over 5,000 patients found St. John's wort was equally effective to standard antidepressants for mild to moderate depression, with a significantly more favorable side effect profile. That Cochrane review has been available since 2008. In America, St. John's wort was systematically downplayed in the late 1990s, precisely when a generation of blockbuster antidepressant patents were reaching their peak profitability. The timing was not a coincidence. Grow it in full sun, in lean soil. It blooms in midsummer, exactly around the summer solstice, which is why it bears the name of the saint whose feast day falls on June 24th. Harvest the flowering tops when the buds are just beginning to open. Tincture in olive oil for 6 weeks for a topical nerve pain preparation, or in alcohol for an internal preparation. And always consult your physician before combining it with prescription medications, because its mechanisms are real enough to require that caution. Number 11. Garlic, the forbidden antibiotic. There is something deeply telling about the fact that the most extensively researched medicinal plant on Earth is also the one most aggressively ignored by conventional medicine as a therapeutic tool. Garlic has been used as medicine for at least 5,000 years. Egyptian papyri dating to 1500 BC document its use for infections, parasites, heart complaints, and fatigue. Hippocrates, the father of Western medicine himself, prescribed it for pulmonary conditions, gastrointestinal disorders, and wounds. The Amish relationship with garlic goes far beyond cooking. Every serious Amish home herbalist kept raw garlic as a frontline antibiotic, antifungal, and cardiovascular tonic. Raw crushed cloves were applied directly to infected wounds. Garlic-infused honey was given for respiratory infections. Garlic tea was drunk at the onset of any systemic illness. The active compound released when a garlic clove is crushed is called allicin, and it is one of the most potent, naturally occurring antimicrobial substances ever identified. Research published in the journal Antibiotics has confirmed that allicin demonstrates inhibitory activity against an extraordinary range of pathogens, including strains of Staphylococcus aureus that are resistant to methicillin, one of the most feared antibiotic-resistant bacteria in modern hospitals. Separate cardiovascular research has documented garlic's ability to reduce LDL oxidation, lower blood pressure, and inhibit platelet aggregation, reducing clot risk through mechanisms that rival pharmaceutical interventions. Crush it. Wait 10 minutes before using or cooking it. That waiting period allows the enzymatic reaction that produces allicin to complete. That single piece of knowledge, ignored by most people who cook with garlic every day, is the difference between a spice and a medicine. And right here, I want to stop for just a moment. Because if you have made it this far into this video, I want you to sit with something. Everything we have covered so far. The elderberry your great-grandmother knew, the yarrow that stopped bleeding on battlefields, the St. John's wort that outperformed antidepressants in clinical trials. None of it was hidden because it did not work. It was hidden because it worked too well, cost nothing, and could not be owned. That is not a conspiracy theory. That is a business model. If this video is opening something up for you, if it is making you angry or curious or both, I want you to do one simple thing right now. Hit the like button. Not for me. Do it because it tells the algorithm that this kind of knowledge matters, that people are hungry for it, and that it deserves to reach the millions of families who have never been told any of this. And if you have not subscribed yet, do it now. We publish every single week, and what is coming in the next few videos may be the most important content this channel has ever produced. Now, let us keep going, because we are only just getting to the plants that made certain boardrooms genuinely nervous. Number 12. Cayenne pepper, the heart attack interrupter. The story of cayenne pepper in ancestral medicine is one of the most dramatic examples of a plant being used with a precision that modern emergency medicine is only beginning to respect. Herbalist Samuel Thompson in the early 19th century used cayenne as a primary circulatory stimulant, and Amish healers in his tradition kept cayenne tincture as what they considered a cardiac emergency preparation. The claim, passed down through generations, was that a strong dose of cayenne in warm water taken at the onset of a cardiac event could stimulate circulation powerfully enough to buy critical time. The mechanism behind this is now documented. Cayenne's primary active compound is capsaicin, which binds to TRPV1 receptors throughout the cardiovascular system, triggering an immediate and powerful vasodilatory response, widening blood vessels and increasing circulatory throughput. Research published in Circulation, the Journal of the American Heart Association, has confirmed that capsaicin activates these receptors in cardiac tissue in ways that are genuinely cardioprotective, reducing ischemic damage during oxygen-restricted events. Separate research from the European Heart Journal found that regular capsaicin consumption was associated with a 26% reduction in cardiovascular mortality in a large population study. Keep a cayenne tincture in your home medicine chest. 1 teaspoon in warm water at the first sign of any cardiovascular event while calling emergency services immediately. This is not a replacement for emergency care. It is what you do in the minutes before emergency care arrives. Those minutes matter more than most people know. Number 13. Feverfew. Feverfew is a plant with a quiet, daisy-like appearance that conceals a pharmacological profile powerful enough that the pharmaceutical industry spent considerable effort and resources trying to isolate its active compounds and build a synthetic version they could own. They largely failed. The whole plant, used as the Amish and European herbalists used it, works better than the isolated fraction. That fact alone tells you something important about the limits of reductionist pharmacology. Amish healers used feverfew primarily for two conditions: fevers that would not break, and the crushing, recurring headaches that we now classify as migraines. Fresh leaves were eaten daily, typically 1 or 2 medium leaves tucked into a small piece of bread to mask the intense bitterness. As a preventive measure for people who suffered chronic migraines, the active sesquiterpene lactone in feverfew is called parthenolide. Research has shown that parthenolide inhibits platelet aggregation, reduces the release of serotonin from blood platelets, and suppresses the inflammatory prostaglandin cascade, all three of which are directly implicated in the initiation of migraine episodes. A double-blind, placebo-controlled trial published in The Lancet confirmed that daily feverfew consumption reduced migraine frequency by 24% and significantly reduced severity in those that did occur. The pharmaceutical response to migraines involves triptans, compounds that cost between $20 and $80 per dose, with frequent rebound headache as a side effect. Feverfew grows easily as an annual or short-lived perennial. Plant it in spring, harvest the leaves through summer. Use them fresh or dried. The prevention protocol is 1 to 2 leaves daily, eaten consistently. Consistency is the key that the ancestral healers always emphasized. Number 14, chamomile, the apothecary in a flower. Do not let the gentleness of chamomile fool you into underestimating it. This small, apple-scented flower is one of the most pharmacologically complex plants ever analyzed by modern chemistry, with over 120 identified active constituents working in concert through mechanisms that a single synthetic drug could never replicate. The Amish used chamomile for virtually everything that required a gentle but persistent intervention: infant colic, digestive cramping, nervous insomnia, skin inflammation, wound healing, menstrual discomfort, eye irritation, anxiety in children. Chamomile tea was the first thing a new Amish mother was taught to prepare, and the last thing many Amish elders drank before sleep every night of their long lives. The primary bioactive flavonoid in chamomile is apigenin, which binds to the same benzodiazepine receptors in the brain that pharmaceutical anti-anxiety drugs target, but with a partial agonist mechanism that produces calm without sedation or dependency: bisabolol and chamazulin. The compounds responsible for chamomile's distinctive blue color when distilled into essential oil are among the most potent natural anti-inflammatory agents identified in plant medicine, with peer-reviewed research confirming their effectiveness against inflammatory skin conditions, including eczema and rosacea. A study published in the journal Phytomedicine found chamomile extract significantly reduced generalized anxiety disorder symptoms over 8 weeks compared to placebo. Grow German chamomile from seed. It self-seeds abundantly and will naturalize in your garden with minimal effort. Harvest the flowers at peak bloom, when the white petals are just beginning to reflex backward. Dry at low heat. Steep 1 heaping tablespoon per cup for a minimum of 10 minutes, covered, to prevent the volatile oils from escaping in the steam. That covered cup is not a detail. It is the difference between medicine and flavored water. Number 15. Hawthorn, the heart's oldest friend. If you were to ask a senior Amish healer to name the single most important plant for lifelong cardiovascular health, there is a strong probability they would say hawthorn without hesitation. This thorny hedgerow shrub, whose berries, leaves, and flowers are all medicinal, has been used in European and American folk medicine for heart health for at least 1,000 years. In Amish tradition, hawthorn berry preparations were given to older community members as a matter of routine, a daily tonic to support the heart through the demands of physical labor, seasonal stress, and advancing age. It was not treated as a crisis intervention. It was treated as maintenance, the way a skilled farmer maintains his equipment before it breaks rather than after. The cardiovascular pharmacology of hawthorn is now one of the best documented bodies of research in botanical medicine. The oligomeric proanthocyanins and flavonoids concentrated in hawthorn exert multiple simultaneous effects on the cardiovascular system. They dilate coronary arteries, increasing blood flow directly to the heart muscle. They improve the efficiency of the heart's contractions without increasing the heart rate. They reduce peripheral vascular resistance, effectively lowering blood pressure through a different mechanism than pharmaceutical ACE inhibitors. And they demonstrate potent antioxidant protection of arterial wall tissue. A large multi-center clinical trial called the SPICE study, involving nearly 900 patients with heart failure, investigated hawthorn extract and found results that were significant enough that several European cardiology guidelines now include hawthorn as a supportive therapy recommendation. In America, that research has received almost no mainstream clinical attention. Plant a hawthorn hedge. It will serve your garden as a wildlife habitat, a windbreak, a security barrier with its thorns, and a pharmacy. The berries ripen in early autumn. Simmer them into a thick syrup with raw honey. Take a tablespoon each morning. Your heart is keeping you alive every second of every day. It has earned that level of attention. Number 16. Turmeric. The golden secret that rewrites inflammation. There is a word that appears in almost every chronic disease diagnosis in modern medicine. That word is inflammation. Heart disease, cancer, Alzheimer's, diabetes, arthritis, depression. Every single one of these conditions has chronic, low-grade inflammation as either a primary driver or a critical accelerating factor. The pharmaceutical industry has built an entire category of drugs around inflammation suppression: NSAIDs, corticosteroids, COX-2 inhibitors. All of them carry significant long-term risks to the gut, the liver, and the cardiovascular system. The Amish healers who settled communities in Indiana and Ohio carried with them a European herbal tradition that had already absorbed the wisdom of ancient Ayurvedic medicine through centuries of trade and knowledge exchange. Turmeric was part of that inheritance. It was used as a poultice for joint pain, as a tea for digestive inflammation, and as a wound treatment for its profound antimicrobial and tissue healing properties. The active compound that modern science has now studied in over 10,000 peer-reviewed papers is curcumin. Curcumin inhibits NF-κB, the master regulator of the inflammatory response in the human body at the genetic transcription level. It does not merely suppress a symptom. It interrupts the signal that tells the body to inflame in the first place. Research published in the journal Oncogene found that curcumin outperformed aspirin, ibuprofen, and several chemotherapy agents as an anti-inflammatory and anti-proliferative agent in laboratory conditions. There is one critical preparation detail that every person must know. Curcumin is poorly absorbed by the body on its own. Combining it with black pepper, specifically the piperine compound in black pepper, increases its bioavailability by up to 2,000%. That pairing is not a modern discovery. Ancient Ayurvedic preparations always combined the two. The ancestral healers knew: grow turmeric in a container if you live in a cold climate. Harvest the rhizomes in autumn. Grate fresh turmeric into warm coconut milk with black pepper and raw honey every single morning. That drink has a name now in wellness culture. It has had a name in ancient healing traditions for 3,000 years. Number 17. Lobelia, the plant they banned for working too well. This is the one I told you about at the beginning of this video. Lobelia implata, known in Amish and American frontier herbal tradition as Indian tobacco, pukeweed, or the asthma plant, was the most powerful respiratory antispasmodic in the entire botanical pharmacopoeia of the 19th century. Herbalist Samuel Thompson built his entire medical system around it. Eclectic physicians used it in hospital settings alongside conventional treatments for asthma, bronchitis, whooping cough, and as a muscle relaxant in cases of tetanus and seizure. Amish healers used lobelia tincture in small, carefully measured doses for bronchial spasms, severe asthma attacks, and as a smoking cessation aid, because lobeline, its primary alkaloid, binds to the same nicotinic receptors as nicotine without producing dependency. And then, in the early 20th century, as pharmaceutical companies began consolidating control over the American medical system through the Flexner Report and the systematic dismantling of botanical medicine schools, lobelia was one of the first plants targeted. It was classified as toxic, its practitioners were prosecuted, and its use was driven underground. Here is what the internal risk assessments of that era actually showed. Lobelia is dose-dependent. In small doses, it is a bronchial dilator and antispasmodic. In large doses, it induces vomiting, which was actually a therapeutic intention in many traditional protocols. At extreme doses, it can be dangerous, like virtually every pharmaceutical drug on the market today. The toxicity argument was not applied consistently. It was applied selectively. Research published in the Journal of Natural Products has confirmed lobelin's pharmacological activity at nicotinic receptors, validating its traditional use for smoking cessation. Studies on lobelia's bronchodilatory alkaloids have confirmed the mechanisms that Thomsonian herbalists documented clinically in the 1820s. This plant is legal to grow and to own. It is not legal to sell as a medicinal product in the United States without navigating significant regulatory complexity. Grow it in your garden as a matter of historical preservation and personal knowledge. Understand it. Respect its dose dependency. And remember that the line between medicine and poison has always been drawn by those who profit from controlling which side of the line you are allowed to stand on. Number 18. Nettle, the mineral warehouse growing in your fence line. Stinging nettle is one of those plants that most people in the modern world have an entirely negative relationship with. You brushed against it as a child. It burned. You learned to avoid it. That reaction is understandable. It is also one of the great botanical tragedies of our time, because the plant you were taught to fear is one of the most nutritionally and medicinally dense plants that grows freely across North America, Europe, and most of the temperate world. Amish communities had a fundamentally different relationship with nettle. They harvested it deliberately, carefully, with gloves in early spring when the young shoots were at their peak. They cooked it like spinach, destroying the sting entirely with heat. They dried it for winter teas. They used the root for urinary complaints and the leaf for seasonal allergies, joint pain, and as a general nutritive tonic for people recovering from illness or exhaustion. The nutritional profile of dried nettle leaf is extraordinary by any measure. It contains more iron than spinach, significant calcium, magnesium, potassium, and silica, along with vitamins A, C, and K in concentrations that rival or exceed most cultivated vegetables. On the medicinal side, nettle leaf has been shown in clinical research to inhibit several key inflammatory pathways simultaneously, including COX-1, COX-2, and NF-κB, making it a genuinely broad-spectrum anti-inflammatory. A study published in Phytotherapy Research found that freeze-dried nettle leaf was rated by 58% of allergy sufferers as equally or more effective than their antihistamine medication. The root has been evaluated in multiple European clinical trials for benign prostatic hyperplasia, with results showing significant improvement in urinary flow and symptom scores. Find the nettle growing at the edge of your property. Harvest it in spring with gloves. Steam it for 3 minutes. The sting vanishes completely. What remains is a dark, mineral-rich green that your body will recognize as exactly what it has been missing. Number 19. Motherwort, the women's heart herb they replaced with pharmaceuticals. The name says everything about the history of this plant. It was named by the people who used it most and needed it most, the mothers. The women navigating the physical and emotional demands of bearing children, raising families, managing households, and growing old in bodies that medicine historically understood very poorly and cared for even less well. Amish women maintained a deep, transgenerational knowledge of motherwort that was passed from grandmother to granddaughter with the same seriousness. That farming knowledge was passed from grandfather to grandson. It was used for heart palpitations associated with anxiety and hormonal fluctuation, for menstrual irregularity and cramping, for the racing heart and nervous exhaustion of postpartum recovery, for the cardiovascular symptoms that accompanied the transition of menopause. The primary active alkaloid in motherwort is lanolin, and it has been the subject of serious cardiovascular research, particularly in China, where the plant has been used in traditional medicine for equally as long as it has been used in Europe. Lanolin has demonstrated negative chronotropic effects in cardiac tissue, meaning it slows and regulates an elevated heart rate. It has also shown uterine regulatory activity, which explains its historical use for menstrual complaints, and anxiolytic properties working through GABAergic pathways. Research published in the journal Phytomedicine confirmed that motherwort extract significantly reduced anxiety and heart palpitation frequency in a clinical population. Separate Chinese research has documented its protective effects against cardiac ischemia at the cellular level. The pharmaceutical industry replaced this knowledge with beta blockers, hormonal therapies, and anxiolytics, all carrying significant side effect profiles, and none of them free. Motherwort grows easily as a perennial in partial shade. It self-seeds generously. Tincture the flowering tops in high-proof alcohol. 10 to 15 drops in water for acute palpitations or anxiety. This is women's medicine that belongs back in women's hands. Number 20. Horseradish. The antibiotic root your ancestors ate with every meal. There is a reason horseradish has been a staple condiment across Eastern European, German, and Amish cooking traditions for centuries, and it is not purely culinary. The communities that ate horseradish regularly with their meals were making a medicinal decision that they did not always articulate in scientific terms, but that they understood intuitively through generations of observation. The people who ate it got fewer respiratory infections. Their sinuses stayed clearer through winter. Their wounds healed with less complication. When you grate a fresh horseradish root, the volatile compounds released are so potent they can clear the sinuses from across a room. That is not an accident of flavor chemistry. That is a biological defense system that the plant evolved and that the human body recognizes as a powerful ally. The primary active compound in horseradish is sinigrin, a glucosinolate that enzymatically converts to allyl isothiocyanate when the root tissue is broken. Allyl isothiocyanate is one of the most potent natural antimicrobial substances known to science. With documented inhibitory activity against a remarkable range of bacterial pathogens, including E. coli, Listeria, Helicobacter pylori, and Candida species. A study published in the journal Phytotherapy Research confirmed that horseradish extract demonstrated stronger antimicrobial activity than several commonly used pharmaceutical antibiotics against multiple tested strains. Amish healers used horseradish poultices on the chest for bronchitis and pneumonia, a practice that delivers the volatile antimicrobial compounds directly through the skin and into the underlying respiratory tissue. They used the fresh grated root mixed with apple cider vinegar as a sinus tonic during cold and flu season. They ate it with every heavy meal as a digestive stimulant, knowing that it dramatically increased the production of digestive enzymes and bile. Grow horseradish in a contained bed because it is aggressively perennial and will spread. Harvest the roots in autumn after the first frost. Grate fresh. Use immediately. The medicinal power of horseradish is at its absolute peak in the first 30 minutes after grating. After that, the volatile compounds begin to dissipate. Your ancestors did not store it. They prepared it fresh because they understood what freshness meant in the context of medicine. That understanding is yours to reclaim. Number 21. Rosemary. The memory plant that neuroscience finally caught up to. There is an old English expression that has been repeated for so many centuries that most people no longer hear the wisdom buried inside it. Rosemary, for remembrance, Shakespeare wrote it into Hamlet. Anne of Cleves wore it in her wedding garland. Mourners carried it at funerals across medieval Europe, placing sprigs into the hands of the dead as a symbol that the living would not forget them. But the Amish understanding of rosemary was not poetic. It was practical and physiological. Rosemary tea was given to elderly community members experiencing memory difficulty and mental fog. It was used as a circulatory stimulant for people recovering from long illness, to drive blood back into cold extremities and a sluggish mind. Rosemary-infused oil was massaged into the scalps of men experiencing hair thinning, a practice that modern dermatological research has now validated in a clinical trial comparing rosemary oil directly to the active ingredient in Rogaine and finding equivalent results at 6 months with significantly less scalp irritation. The neurological research on rosemary is among the most compelling in botanical medicine. The primary active compound responsible for its cognitive effects is 18-cineol, a terpenoid that crosses the blood-brain barrier and directly inhibits the enzyme that breaks down acetylcholine, the neurotransmitter most critically associated with memory formation and recall. This is the exact same mechanism targeted by pharmaceutical drugs prescribed for Alzheimer's disease. A study conducted at Northumbria University found that simply being in a room diffused with rosemary essential oil significantly improved speed and accuracy scores on memory tests in healthy adults. Separate research published in Therapeutic Advances in Psychopharmacology confirmed dose-dependent cognitive enhancement from rosemary extract supplementation. Grow rosemary as a perennial shrub in a sunny, well-drained location. In cold climates, bring it indoors for winter, or treat it as an annual steep to fresh sprigs in boiling water for 10 minutes each morning. Drink it before mentally demanding work. Breathe the steam deliberately as it steeps. You are not making tea. You are feeding your brain the compound it was designed to receive. Number 22. Organo, the natural antibiotic with a 99% kill rate. In the pantheon of antimicrobial plants, organo oil occupies a position so extraordinary that researchers who first encountered its laboratory results assumed there had been an error in the methodology. There had not been an error. Oil of oregano, specifically oregano grown in Mediterranean highland conditions where the plant produces its highest concentration of active phenols, demonstrates antimicrobial activity against pathogens that have developed full resistance to multiple classes of pharmaceutical antibiotics. The Amish preserved the Mediterranean herbal tradition through their Swiss and German Anabaptist heritage, and oregano was a constant presence in their kitchen gardens, understood simultaneously as a culinary herb and a medicinal tool. Fresh organo tea was used for respiratory infections, digestive parasites, and fungal conditions of the skin and nails. Organo-infused honey was kept for sore throats and mouth infections. The dried herb was burned, and the smoke inhaled for bronchial congestion in a practice directly parallel to what we now understand as volatile compound delivery. The two primary active phenols in oregano oil are carvacrol and thymol. These compounds disrupt the cellular membrane integrity of bacterial, fungal, and viral pathogens with a mechanism that is fundamentally different from pharmaceutical antibiotics, which is precisely why pathogens have so much more difficulty developing resistance to them. A study published in the Journal of Applied Microbiology found oregano oil effective against all 25 bacterial strains tested, including multiple antibiotic-resistant strains. Research from the Department of Food Science at the University of Tennessee found that carvacrol destroyed norovirus surrogate particles within 1 hour of exposure. Georgetown University researchers published findings showing oregano oil was as effective as standard antibiotics against Staphylococcus bacteria in animal models. Grow oregano in full sun in lean, well-drained soil. The more you stress the plant by withholding water and fertilizer, the higher its phenol concentration becomes. Harvest just before flowering for maximum potency. Dry in small bundles hung upside down in a warm, dark space. For therapeutic use, the oil requires a high-quality steam distillation process that produces a concentrated product standardized to carvacrol content. Look for a minimum of 70% carvacrol on the label. Anything less is culinary. Anything above is medicine. Number 23. Marshmallow root, the forgotten soother of every inflamed surface in the body. The name marshmallow conjures images of campfires and sugar confections, and that trivial association has done enormous damage to the reputation of one of the most therapeutically elegant plants in the entire herbal tradition. The original marshmallow candy was made by whipping the thick, viscous gel extracted from Althea officinalis root with sugar. Because the root itself produces one of the most extraordinary natural mucilaginous compounds known to plant medicine. That gel is called mucilage, and its therapeutic principle is deceptively simple. It coats, it soothes, it protects. Every inflamed, irritated, or damaged surface it contacts is physically enveloped in a soothing, protective layer that allows healing to proceed underneath without ongoing irritation. Amish healers used marshmallow root for a remarkably wide range of conditions because they understood this single, elegant mechanism and recognized how many conditions in the human body involve inflamed mucosal surfaces, sore throats, gastric ulcers, irritable bowel, urinary tract infections, dry, persistent coughs, inflamed bronchial passages. All of these conditions involve mucosal surfaces that are irritated, raw, and in need of exactly the protection that marshmallow root provides. The primary active polysaccharide responsible is rhamnogalachironin, and its mechanisms have been studied and peer-reviewed. Gastroenterology research with results confirming significant protective effects on gastric mucosal tissue. A study published in Complementary Medicine, research found marshmallow root syrup significantly reduced irritating dry cough symptoms within 1 week of use, with no adverse effects. European herbal medicine regulatory bodies, which are considerably more open to botanical evidence than their American counterparts, have issued positive monographs on marshmallow root for both oral and respiratory mucosal applications. Here is the critical preparation detail that most people get wrong. Marshmallow root mucilage is destroyed by heat. You must prepare it as a cold infusion. Place 2 tablespoons of dried root in 2 cups of cold water. Allow it to sit overnight. Strain in the morning. What you have is a thick, slightly viscous liquid that feels unlike any other herbal tea you have ever made. That texture is the medicine. Drink it slowly. Let it coat as it travels. Number 24. Black cohosh. The hormone whisperer the pharmaceutical industry tried to clone. Few plants in the entire North American botanical tradition have been subjected to as much research, controversy, misrepresentation, and ultimately vindication as black cohosh. This native woodland plant, with its tall spikes of creamy white flowers rising from the forest floor, was used by indigenous nations of the eastern woodlands for centuries before European contact. Cherokee healers used it for menstrual irregularity, childbirth support, and joint pain. When European settlers arrived and Amish communities began establishing themselves in the forests of Pennsylvania and Ohio, they learned about black cohosh from indigenous neighbors and integrated it into their own healing tradition with characteristic thoroughness. It became the primary botanical intervention for the full spectrum of female hormonal transitions, from adolescent menstrual irregularity through the complete arc of menopausal symptoms, including hot flashes, night sweats, mood disruption, and sleep disturbance. When pharmaceutical researchers in the mid-20th century began investigating black cohosh, they initially assumed its activity was estrogenic, that it was acting as a phytoestrogen in the body. They were wrong, and that misunderstanding created a decade of unnecessary controversy around its safety for women with hormone-sensitive conditions. Subsequent research has now clarified the actual mechanism. Black cohosh does not act as an estrogen. It acts on serotonin receptors and opioid pathways in the central nervous system that regulate temperature control and mood, which is why it addresses hot flashes and mood symptoms without the risks associated with estrogen supplementation. A clinical trial published in the journal Menopause found black cohosh extract significantly reduced hot flash frequency and intensity over a 12-week period. A Cochrane review of 16 randomized trials concluded there was meaningful evidence supporting its use for menopausal symptoms. Harvest the root in autumn from plants that are at least 3 years old. Tincture and 60% alcohol for maximum extraction of the active triterpene glycosides. Take consistently for a minimum of 8 weeks before evaluating results. Hormonal systems respond to sustained signals, not single doses. That patience was built into the ancestral understanding of this plant from the very beginning. Number 25. Goldenrod, the misunderstood healer that millions blame for their allergies. There is one of the great botanical injustices of modern times playing out every September across North America. Millions of people look out at fields of brilliantly golden goldenrod in full bloom and blame it for their runny eyes, congested sinuses, and sneezing fits. They are wrong. Goldenrod is insect-pollinated. Its heavy, sticky pollen does not travel through the air. It cannot cause hay fever. The actual culprit is ragweed, a dull, inconspicuous plant that blooms at exactly the same time as goldenrod and releases enormous quantities of lightweight airborne pollen. Ragweed is invisible. Goldenrod is spectacular. And so goldenrod has been carrying the blame for ragweed's crimes for generations, which means that millions of people are actively avoiding one of the most powerful anti-inflammatory, antimicrobial, and urinary tract supportive plants in the entire North American flora. Amish healers knew goldenrod well and used it without any of this confusion. It was a primary remedy for kidney and urinary tract infections, for upper respiratory catarrh, for chronic sinusitis, and paradoxically, as an antihistamine preparation for allergy symptoms. Yes, the plant that people blame for allergies actually contains compounds that reduce allergic response. The irony is complete. The active flavonoids in goldenrod, particularly rutin and quercetin, have been extensively studied for their anti-inflammatory and antihistamine properties. Quercetin specifically stabilizes mast cells, the immune cells responsible for releasing histamine during allergic reactions. With research published in the International Journal of Molecular Sciences confirming its effectiveness as a natural antihistamine comparable in mechanism to pharmaceutical H1 blockers, European Commission E, the German herbal medicine regulatory body that is considered the gold standard of botanical medicine evaluation, has approved goldenrod as a treatment for urinary tract infections and kidney stones, recognizing its diuretic, antispasmodic, and antimicrobial properties in the urinary system. Find goldenrod growing wild along roadsides and in open fields in late summer. Harvest the flowering tops when they are at peak bloom. Dry thoroughly in a warm, ventilated space. Steep generously in hot water for 15 minutes, and the next time someone tells you they are allergic to goldenrod, share what you have just learned. Correcting that misunderstanding is itself a small act of reclaiming ancestral wisdom from the fog of modern confusion. Number 26. Boneset, the fever breaker that saved entire communities. There is a name embedded in the history of American botanical medicine that appears again and again in accounts of epidemics, frontier illness, and community survival during the most medically vulnerable centuries of this nation's past. That name is boneset, Eupatorium perfoliatum, a tall, rough-leaved native plant with clusters of small white flowers that grows in wet meadows and along stream banks across eastern North America. The name boneset did not come from bone healing. It came from a 19th century term for influenza, which was called breakbone fever because of the excruciating deep muscle and joint pain that accompanied it. Boneset was the plant that broke the fever of breakbone fever. Amish and frontier communities kept dried boneset as an absolute medical essential. When influenza swept through a settlement, and in the 19th century, it swept through with devastating regularity. Boneset tea was prepared in large quantities and administered around the clock to the sick. It induced sweating, which broke the fever cycle. It eased the deep, aching pain in the muscles and joints. It supported the immune response through the critical hours when the illness was at its peak. The active immunostimulant polysaccharides in boneset have been studied by German researchers who confirmed significant macrophage activation and interferon induction, meaning boneset directly amplifies the body's own viral defense systems at the cellular level. Sesquiterpene lactones in the plant have demonstrated anti-inflammatory activity in peer-reviewed. Grow boneset in a moist, partially shaded area of your garden. It is a native perennial that will return reliably each year. Harvest the leaves and flowers at peak bloom in late summer. Dry completely before storing. Steep 1 tablespoon per cup of hot water for 10 minutes at the first sign of any flu-like illness. Your great-great-grandparents survived waves of pandemic illness with this plant. That knowledge belongs to you. Number 27. The United States, and you have a fence or a trellis in your garden. There is a reasonable chance that one of the most sophisticated natural anxiolytic plants ever studied by neuropharmacology is already trying to grow on it. Passionflower is one of those botanical medicines whose visual beauty seems almost designed to communicate its purpose. The flower is extraordinarily complex, layered, and intricate in a way that feels almost surreal, and the effect it produces on the human nervous system is equally nuanced. Not sedation, not numbness, a quieting, a settling, a return to the baseline of calm that anxiety disorders chronically disrupt. Amish healers in the mid-Atlantic states were introduced to passionflower through contact with indigenous communities who had used it for generations, and they adopted it immediately into their repertoire for nervous complaints. Insomnia, rooted in anxious rumination, and the racing mind that refuses to release its grip at the end of a long and difficult day. It became a particular ally for people in the community dealing with grief, with the anticipatory anxiety of difficult seasons, and with the kind of chronic low-level worry that wears a person down over months and years. The neuropharmacological research on passionflower has identified its primary mechanism as the enhancement of GABA activity through a different receptor binding profile than either valerian or lemon balm, meaning the three plants can be combined for a genuinely synergistic effect without redundancy. A clinical trial published in Phytotherapy Research directly compared passionflower extract to oxazepam, a prescription benzodiazepine for generalized anxiety disorder. The results showed equivalent effectiveness on anxiety scores. Passionflower produced zero impairment of job performance. Oxazepam did. Grow it as a perennial vine in zones 7 and above. In colder climates, grow it as an annual or bring the roots inside for winter. Harvest the leaves and tendrils through the growing season. Steep 2 teaspoons of dried herb per cup for 15 minutes in the evening. Add lemon balm if the anxiety has a nervous stomach component. Add valerian if the sleeplessness is the dominant symptom. Your garden is a pharmacy. You simply need to know how to read the labels. Number 20. Red clover. The blood purifier they pulled from the cancer ward. Red clover is a plant with a history so layered, so politically charged, and so scientifically complex that covering it fully would require its own dedicated video. But here is what you need to know today. For over a century, red clover blossoms were a cornerstone of what 19th and early 20th century herbal medicine called alterative therapy, meaning medicine that gradually and fundamentally improves the condition of the blood and lymphatic system over time. Amish healers used red clover tea as a long-term tonic for skin conditions rooted in what they called impure blood, for chronic respiratory congestion, and for the kind of deep, systemic inflammatory states that resist acute treatment and require weeks and months of gentle, persistent botanical support. It was also quietly and significantly one of the primary botanical components of the Hoxsey formula, a botanical cancer preparation that was used in clinics treating tens of thousands of patients in the mid-20th century before being forcibly shut down by the FDA in a legal campaign that spanned decades. Harry Hoxsey's own documentation of patient outcomes was extraordinary enough that a sitting United States senator underwent his treatment. The formula was driven out of the country. The clinic relocated to Mexico, where it still operates today. The isoflavones in red clover, including pharmanonin, bioshannon, adadzine, and genistein, are among the most extensively studied phytochemicals in botanical medicine. They function as selective estrogen receptor modulators, meaning they occupy estrogen receptors in a way that produces beneficial estrogenic effects in tissues like bone and the cardiovascular system, while blocking more aggressive estrogenic stimulation in hormone-sensitive tissues. Research published in Remedies has shown red clover isoflavone supplementation significantly reduces menopausal hot flash frequency. Separate research has documented its protective effects on bone mineral density and arterial elasticity. Grow red clover as a cover crop in your garden beds during the off-season. It fixes nitrogen into the soil, feeds the pollinators, and produces a continuous harvest of medicinal blossoms from late spring through autumn. Dry the flower heads completely. Steep generously. Drink it as a long-term tonic, not a crisis intervention. The ancestral healers understood that the deepest healing happens in seasons, not in single doses. Number 29. Ashwagandha, the stress destroyer at the crossroads of East and West. Ashwagandha occupies a unique position on this list because it represents the meeting point of two great ancient healing traditions that, despite arising on opposite sides of the world, arrived at remarkably similar conclusions about the nature of stress, resilience, and the kind of deep vitality that no pharmaceutical drug has ever been able to manufacture. In Ayurvedic medicine, ashwagandha has been classified for over 3,000 years as a rasayana, a rejuvenating tonic that builds oyas, the Sanskrit term for the deep, vital essence that modern biomedicine would recognize as a combination of immune competence, hormonal balance, neurological resilience, and cellular energy production. The Amish connection to ashwagandha came through the same pathway as turmeric, through European herbalism's long absorption of Eastern botanical knowledge through trade routes, and through the 19th century, American eclectic physicians who actively studied every healing tradition they could access. It was used in these traditions for exactly the conditions that define our modern epidemic of chronic stress. Exhaustion that sleep does not fix. Anxiety that has no specific object. A body that is always slightly inflamed, always slightly reactive, always running slightly too hot. The scientific category that modern adaptogens research has built around ashwagandha is called HPA axis regulation. Referring to the hypothalamic pituitary adrenal axis, the central command system of the stress response, ashwagandhas, with analydes, its primary bioactive steroidal lactones, have been shown to reduce cortisol levels measurably, restore thyroid hormone balance in subclinical hypothyroid conditions, increase testosterone in men with low levels, and improve VO2 max and muscular recovery in athletic populations. A double-blind, randomized, placebo-controlled trial published in the Indian Journal of Psychological Medicine found that ashwagandha root extract significantly reduced scores on every validated stress and anxiety assessment used, while reducing morning cortisol levels by nearly 28%. That is not a subtle effect. That is a result that any pharmaceutical company would have built an entire drug category around if they could have patented the molecule. They cannot grow ashwagandha as an annual in most North American climates. It prefers dry, sandy soil and full sun, which mirrors its native habitat in the dry regions of India and North Africa. Harvest the roots in autumn after the first year. Dry them slowly at low heat. Powder the dried root and take half a teaspoon in warm, full-fat milk each night before sleep. This preparation has a name in Ayurvedic tradition that translates roughly as moon milk. It has been taken by human beings every night for 3,000 years. There is a reason traditions that old survive. Number 30, dandelion, the ultimate secret of the Bible garden. And here we are, the last plant, the one I told you to wait for. And I need you to notice something about this moment. After 29 plants, after learning about alkaloids and flavonoids and withanolides and proanthocyanidins and every other exotic-sounding compound that makes the pharmaceutical industry's profit model look like a very expensive imitation of what the earth already provides freely, the final secret of the Bible garden is the most common plant in the world. It is growing in your lawn right now. You may have poisoned it with herbicide last spring. The dandelion, Taraxacum officinale, a plant so ancient, so universal, so embedded in the healing traditions of virtually every culture on earth, that the question is not why our ancestors revered it. The question is how we were convinced to hate it. Amish healers used every single part of the dandelion with a comprehensiveness that reflects a deep, multi-generational familiarity with its full therapeutic profile. The root, harvested in autumn when its inulin concentration is at its peak, was roasted and used as a liver and digestive tonic, stimulating bile production, supporting detoxification pathways, and feeding the beneficial bacteria of the gut microbiome with prebiotic fiber. The leaf, harvested young in spring, was eaten as a salad green that is more nutritionally dense than virtually any cultivated vegetable in your grocery store. Containing more beta-carotene than carrots, more calcium than milk per gram, and higher iron content than spinach. The flowers were made into wine, into honey, into skin preparations for age spots and uneven pigmentation. The milky sap of the stem was applied directly to warts, to skin tags, and to fungal conditions of the skin, with results that modern dermatological research has begun to take seriously. The scientific literature on dandelion has expanded dramatically in the past 15 years as researchers have begun to look seriously at what the ancestral traditions were pointing to. Dandelion root extract has demonstrated apoptotic activity against human cancer cell lines in laboratory research, including leukemia, pancreatic cancer, and colon cancer cells, through a mechanism involving the selective induction of programmed cell death in malignant cells without affecting healthy cells. I want to be precise here, because precision matters and because this channel will never make irresponsible claims about cancer treatment. These are laboratory findings, not clinical trials. They are significant enough to warrant urgent further research. They are not a prescription. What is documented beyond any serious scientific dispute is dandelion's activity as a liver protective agent. Its diuretic effect that is unique in being potassium-sparing, unlike pharmaceutical diuretics, its anti-inflammatory properties through TNF-alpha and nitric oxide suppression, and its profound prebiotic effect on gut microbiome diversity. A study published in Evidence-Based, Complementary, and Alternative Medicine confirmed dandelion extract's hepatoprotective effects against chemically induced liver damage in animal models. European phytotherapy research has documented its choleretic activity, meaning its ability to stimulate bile flow, making it one of the most effective natural liver and gallbladder tonics available. The reason dandelion is the last plant on this list is not because it is the most exotic or the most dramatic. It is because understanding everything that came before it allows you to truly see what it represents. Every culture on Earth discovered this plant. Every healing tradition on Earth used this plant. It grows on every continent except Antarctica. It asks nothing of you in return for everything it offers. It pushes up through cracks in concrete. It returns after every attempt to destroy it. It has been here longer than any pharmaceutical company, and it will be here long after every one of them is gone. And that is the real lesson of the Bible garden. Not that these 30 plants are magic, not that they replace every tool of modern medicine, because some of those tools are genuinely extraordinary, and some of them save lives in ways that no plant ever could. The real lesson is this: the earth was here before the prescription pad. The earth will be here after it. And somewhere between the dandelion pushing through your driveway crack and the boardroom meeting where someone decided that knowledge should cost money, something was taken from us, something we did not consent to lose. The Amish communities who preserved this knowledge did not do so out of stubbornness or ignorance. They did it because they understood something that the speed of modern life makes very difficult to remember. That the relationship between a human being and the land they live on is not a romantic notion. It is a survival strategy. It is a medical system. It is a form of sovereignty that no company can sell back to you at a markup. Your grandmother knew some of these plants. Her grandmother knew all of them, and now, after this video, so do you. That knowledge is yours. Protect it, grow it, share it, and pass it to the next generation with the same quiet seriousness that every Amish grandmother in Lancaster County passed it to hers. Before you go, I want to ask you something specific, because the answer in the comments will shape the next video we create for this community. Of all 30 plants we covered today, which one surprised you the most? Was it lobelia, and the story of how it was systematically removed from American medicine? Was it dandelion growing freely in your lawn this entire time? Was it St. John's wort outperforming antidepressants in clinical trials while being largely ignored by mainstream American psychiatry? Tell me in the comments below. Your answer matters, because this channel exists to recover exactly the knowledge that your answer points toward. If this video gave you something real today, share it with one person in your life who needs it, not 10 people, just one, the person whose face came to mind while you were watching. You already know who they are. Subscribe if you have not already, because next week we go even deeper. And until then, tend your garden. It knows what it is doing.